but we also want to make sure that we contribute towards making sure that we encourage young people to access and share as much information as possible on issues of health. Thank you again, ladies and gentlemen, for joining us for today's webinar. As I had introduced myself, I am Senzo Malaza. I will be moderating this webinar. Amongst our, maybe let me start by acknowledging our partners at Georgetown University, and can I also acknowledge the Royal Science and Technology Park and all partners involved in the hosting or preparation for the hosting of the hackathon that we are talking about today. Ladies and gentlemen, I do hope my guests or speakers for today are actually ready for presentations that are going to be made. We actually have two speakers that will be presenting. We have Ms. Sanelsiwe Mkwanazi from the Royal Science and Technology Park and Dr. Arnold from Georgetown University. But I'll kick off. I know that we usually say ladies first, but for today's webinar, we will kick off with Dr. Arnold, who is the Strategic Information Data Use and National TB Program Support Center for Global Health Practice and Impact at the Georgetown University, Eswatini. Dr. Arnold, I hope you can hear me and I hope you can kick off with your presentation today.
Good morning, everyone.
Good morning, Doc.
You can hear me?
Yes, sir, I can hear you.
I will, for the purposes of managing the bandwidth, I will turn off my video just in case people might think there's an imposter presenting on my behalf. So I will introduce myself briefly and then I'll turn off the video so that I can talk about today's agenda. As said, my name is Arnold Mafukidze. I'm with Georgetown University in Eswatini for the Center for Global Health Practice and Impact. We are a center that comes out of Georgetown University in Washington, the oldest Jesuit university in the world. Currently in Eswatini, we've been present since 2018, but we have two major projects that we're currently implementing in Eswatini in collaboration with the Ministry of Health. One of them is called CSEC, or Supporting Eswatini Achieve and Sustain Epidemic Control for HIV. The other one is called Blossom, which is a community vision of this clinical program. The CSEC program is the one that is going to be implementing this particular hackathon. All the work and activities that we're going to talk about are supported by the United States government through PEPFAR, CDC. And I think I'll just want to take this opportunity to express our gratitude to CDC and PEPFAR for affording Georgetown the opportunity to implement CSEC program and to actually initiate this activity that is very important to solve some of the health issues in Eswatini. I'll go straight into today's agenda, but just indulge me as I switch off my video so that we can manage bandwidth. Thank you very much.
Before you continue, Doc, may I humbly request, sorry, Doc, before you continue, may I humbly request participants to kindly switch off their microphones because we seem to be disturbing the presenter. Ladies and gentlemen, may I humbly request that we take note of the fact that someone is on the podium and we switch off or we mute our program, our microphones. Thank you. Over to you, Doc.
Okay. I think some of the information about who Georgetown University is may not necessarily be covered in this session, but I've already introduced the work that we're doing. Currently, we're implementing what is called a CSEC project, which is a facility-based clinical support program that is strengthening systems for the delivery of quality assured HIV prevention, care and treatment services in Manzini and Lubombo. We also support the Ministry of Health at central level through the National AIDS Program, as well as the National TB Control Program and the regional management health teams for both regions in ensuring that they develop these guidelines that are used for patient management and translate them with fidelity at facility level for outcomes. As you are aware, Eswatini, being the country with the highest HIV prevalence in the world, currently sitting at 26.2% of the population as of 2019. We also were the first country to achieve 95 targets that were set by UNAIDS, and we achieved them way ahead of time, way back in July of 2021. And we are currently sitting at around 97% of all people living with HIV are aware of their status. 98% of them are on treatment, and of those that are on treatment, 99% of them are virally suppressed. However, although at population level that we are doing very well as a country, we still have pockets within our population where those indices that I've just talked about, and I know that sometimes it becomes technical, they have not reached that same level. And one of that group are adolescent girls and young women aged between 15 and 29. They remain disproportionately affected by HIV in Eswatini, despite all the progress that we've made. And one of the things that we all appreciate is they face a unique issue with barriers to accessing care, whether it is stigma, lack of information, or logistic challenges. In trying to optimize technology to try and address some of these health issues in line with the e-governance strategy of His Majesty the King, as well as the e-health strategy of the Ministry of Health, we are working with the Royal Science and Technology Park on an exciting initiative that is aimed at solving this real-world health challenge. And for this one, we're specifically focusing on the health needs of adolescent girls and young women. We want to find the right solutions that are digitally driven, innovative, and make it easier for young women to access HIV prevention, treatment, and support services. So why are we doing this together with the RSTP? I think the RSTP is a strategic partner for anyone in the country who wants to, champion His Majesty's vision for e-governance. It's the hub for innovation, and I think we are privileged to have been afforded the opportunity to work with the RSTP, and we really hope that we're going to bring together the brightest and most relevant minds out there to try and solve this issue that I've just highlighted. And the primary purpose really is to create an innovative, user-centered digital solution that caters directly for the needs of adolescent girls and young women. We want to empower them with the tools that make it much easier to access health services, that make it simpler to access health service, that also makes it much easier for them to maintain their confidentiality and makes it more efficient for the services that are available currently to be delivered to their specific constituency. We are focusing on this group. Don't like using the word vulnerable, but we consider them a priority population, not a vulnerable population. And we want to have a significant impact on reducing new HIV infections. Like I've mentioned, although we have very good indicators that the epidemic is coming under control. After the last population survey on HIV impact in Eswatini, which we call SHIMS, one thing that never changed is the number of annual new infections within adolescent girls and young women, what we call annual incidents. And that has remained very high. So these infections are still very high among adolescent girls and young women. And we want to find solutions that can strengthen the efficiency and effectiveness of delivery of services, especially for HIV prevention within that population. And when we're saying user-centered design, we are going for a different direction here. The target group that we have currently for this solution is really people who are going to interact with the final end users of the solution. And AGYWs, as we call them, or adolescent girls and young women, are not just the focus of this solution. They are actually the source of this user needs that will drive it. The hackathon challenges most of the people that are online and those that have failed to join, and you convey this information to them, that they should think from the perspective of the young woman and adolescent girl, ensuring that the solutions that we're going to be proposing are responsive to the real life needs and challenges. I think a critical question that will come is, what value does it bring for IT professionals, young IT professionals out there to join this hackathon? Number one, we're addressing a critical issue. I think as part of citizenship, as part of patriotism, we all want to contribute in our small ways to the betterment of the society. And by joining this hackathon, participants will tackle one of the most pressing health issues in Eswatini, empowering adolescent girls and young women to take control of their health. This is a chance to create something that can truly change lives. I think one of the things that really drives human beings is a desire to have purpose and impact. And this is an opportunity for us to make healthcare more accessible to young women. Number two, it's a career opportunity and it's an opportunity for networking. This hackathon is going to provide a unique opportunity to network with other professionals in the fields of digital health and healthcare innovation. You'll be able to solve real life problems, which gives you a hands-on experience that could open doors for your future in terms of employment or any entrepreneurial adventures that you have. And then number three, again, emphasis is on making real impact. This is more than just a hackathon, it's more than just an exercise. It's a platform where your ideas could be harnessed to turn into actual solutions used to solve real social issues. And in this case, it's the health of adolescent girls and young women across the country. So the winning teams will have the opportunity to further develop their solutions, potentially securing contracts or internships with Georgetown University or with the RSTP or any other partners. So this is bigger than just an exercise. And I know that, there are many questions that have come up since the adverts came out. What are the prices? What's the pricing structure? The real issue here is we are viewing this together with the RSTP as an opportunity for a horizon outlook to each and every individual's individual ambitions, but also their collective ambitions in making an impact. So don't view this just as something that will line your pockets. View it as something that will grow your career, something that will increase your network, something that will give you more opportunities and open up more doors in your career as an IT professional. I would want, of course, to leave some tips. I know that my colleague, Sanliso, is going to talk much about the actual technicalities. But some of the tips that I would want the participants to keep in mind for them to be successful in this hackathon is, number one, you need to understand the needs of the adolescent girls and young women. The success on this hackathon will really depend on how well you understand the challenges faced by AGYW. So it means that between now and the time when the activity is launched, you need to make yourself abreast to the available literature, whether it's in print media or it's in actual published academic literature. Take time to research on the healthcare needs, the barriers to accessing services, the daily realities that are faced by these particular constituents. And your solution should therefore be something that directly addresses these pain points. So it's not supposed to be something that you pick out from the air, something that you thumbsuck. It has to really respond to the needs of adolescent girls and young women. Number two, focus on user experience. I think in the advent of AI, it's very easy to get things off the shelf. But this is Eswatini, it's unique in its nature. Therefore, the solutions that we are looking for here are not only just solutions for AGYWs, but solutions for AGYWs in Eswatini. And they are supposed to be easy to use. They're supposed to be discreet. They're supposed to be accessible on platforms that they are most familiar with in Eswatini, whether it's mobile devices or whatever it is that they are using, and ensure that that solution is intuitive, it's user-friendly, and designed with the end user in mind. So the innovation really is not about showing our individual prowess and aptitude, but really about how we can apply our knowledge into real world, which is, the actual application of wisdom. Make sure you collaborate effectively. Diverse teams produce the most innovative ideas. So try to leverage each team member's strengths, whether it's technical, creative thinking, knowledge, or anything. And it wouldn't be complete without mentioning that it would be ideal to actually have an adolescent girl or young woman as part of your team, because then you actually are going to get real-time feedback on whether or not this is something that will apply to them. Ensure that the solution is practical. It should not be innovative only, but also practical and scalable. We are hoping that we are starting something that will form a fulcrum on digital health solutions for specific subpopulations that are left behind, not just in HIV response, but there are many, many problems in the healthcare that are coming up. You have, non-communicable diseases that are coming up, affecting most of the middle-aged adults. We have lots of issues with mental health issues that are affecting most of the working population. So we hope that as you think about this, let it be something that is scalable, something that is practical, something that is relatable to other people who may not necessarily be addressing HIV. So what is today's call to action? I think mine is a very simple call to action. Number one is, we are really appealing for a massive turnout to join us to make a difference. The more the merrier, the more brains the merrier. Competition and an environment of meritocracy is always a drive for absolute solutions. And what we want here is an absolute solution, something that will solve the issues that we've faced for the past 2 decades. So this is an opportunity to be part of a transformative initiative. By participating in this hackathon, you are directly contributing to improving healthcare access for adolescent girls and young women in Eswatini. We need your creativity, we need your skills, and we need your passion to bring innovative digital solutions to life. We also really want your idea to help remove barriers that prevent young women from accessing care. Let's work together to create a future where AGYWs can easily manage their health, access HIV prevention and treatment within the touch of a button. And we're hoping that after today, you're going to sign up just after this webinar and be part of something that is impactful. Thank you very much. If there are any questions, I'll get from the audience, but that was my presentation. Over to you, moderator.
Thank you very much, Dr. Arnold. I think we will take questions after the second presentation because we have 2 presentations only. So ladies and gentlemen, if you have any questions for the first presenter, please note those. And then after the second presentation, you can then pose those questions. Can I now invite my colleague, Ms. Sanelsiwe Mkwanazi from the Royal Science and Technology Park to make her presentation. Over to you, Ms. Mkwanazi.
Thank you so much, Mr. Program Director and Dr. Arnold. I think for my part, we'll just get into the technicalities because Dr. Arnold has said all the nice things about the hackathon. I'm sure he has motivated every one of us to join.
I'm not sure if you are able to switch on your camera, Ms. Mkhwanazi, so that we can know who is presenting.
It's
Just as you do your
my
presentation.
apologies, it's not on. Okay, thank you so much. Let me try to figure it out. How is it now?
Now we can see you. You can go ahead and do your presentation. Thank you very much.
Okay, thank you. Thank you so much, Mr. Malaza. I will get into the technicalities. Okay, my presentation will cover how to register for the hackathon, how it will be set up, because I think it's a question of many of the people who have already registered and some will still register on how the whole setup of the hackathon will be like. It will also cover the eligibility criteria, evaluation criteria, the timelines of the hackathon, and also contact information about how you can actually get to us, especially if you've got questions regarding the registration form. We have tried to make registration as simple as possible. You can follow the QR code that is shown on the screen and also that link, and we encourage each and every one of you who wants to register for the hackathon to ensure that you answer each and every question that appears on the form, because it will actually help us to pre-select, because currently for the teams that are going to take place or code at the main hackathon event, we are going to pre-select 10 teams. So we encourage each and every one of you to make sure that you answer all the questions that appear in the form. So the hackathon, the main event, will take place on 24 to 25 October 2024. It will be a Thursday and a Friday. It will start Thursday at 8 a.m. and it will end Friday at 5 p.m. So we will give access to all the participants will be given meals for the duration from the 8 a.m. to 5 p.m. until they leave, access to rooms for freshening up, and also internet. Those things we will ensure that we provide all those things to all the participants of the hackathon. Okay, in terms of eligibility criteria, we are looking at teams. If you are an individual, you are going to be disqualified. We received so many questions saying, can I join alone? We are looking for teams of at least 2 to 3 members. From the age of 16 to 35. As part of those teams, we want at least one member to be female, and that female has to be between 18 and 30 years. Dr. Arnold earlier on emphasized the importance of understanding the problems that this particular age group experience. So for you to understand what the problems are, you need to ensure that at least one of your team members is that female between the ages of 80 to 30. In terms of background and expertise, we are looking that for at least one member of the team should have a tertiary qualification, because this is not just a competition. From the stage, the winning team will be developing a solution with Georgetown. So we want to ensure that at least one member of the team has project management skills and also maturity and also resilience. Hence, we want at least one member of the team to have a tertiary qualification. It might not be a tertiary qualification in ICT, but the tertiary qualification in ICT will be an advantage. So we've been getting many questions that in terms of tertiary qualifications, are you looking for a degree? Are you looking for a diploma? Are you looking for a master's or a PhD? Even if it's a diploma and advanced diploma, but we need that one member of the team to have at least that one tertiary qualification. And then we want all the teams that are going to be pre-selected, the final 10 teams for the main hackathon, we want them to be able to fully commit from the 24th to the 25th of October. So we are not going to encourage maybe one member of the team coming during the day and leaving. So we want all the teams to be able to ensure that they are able to participate from the morning we come on 24 October on Thursday morning and leave on 25th October at 5 p.m. And then lastly, we've got a team inclusivity policy where we want each participant should register to be a member of one team. If we find that one participant has registered to be member of many teams, then unfortunately, we are going to disqualify you. Hence, we encourage that each participant be a member of one team. Obviously, going forward in terms of eligibility, when we are now selecting, we are going to look at other things in terms of your experience, in terms of the coding languages, and also what have you done, innovations that have you done in pre-selection. So we encourage that when you are filling in the form, not to be in a rush, but make sure that the information available to us for pre-selection is comprehensive as much as possible. And then in terms of evaluation criteria, we are going to look at innovation. That's how original or creative and creativity of the solution. In terms of innovation, it might not be a new solution, but we want to see that you understand the problems, local problems for the HGWY group, and then we need to see that you have tailored the solutions for that particular problem. We don't want to see that you have taken something out of the shelf and you haven't really evaluated that does it meet the needs of this particular gap that you are trying to address. So please try to ensure that you are original as much as possible, and also creativity. As I've said, in terms of innovation, it might not be something that's entirely new, but it has to be something that has an aspect of something that is new to the particular group that you're trying to serve in. It's actually addressing a gap that's there, and it's a solution that can be able to be used. We are also going, obviously, to be looking at impacts. We are going to evaluate the potential benefits of the solution that you have proposed to the target participants, just to see if the meets are going to be made, as I've stated earlier, and also technical execution, which is going to be much important, which will look at the functionality and the usability of your prototype after the session at 5 p.m. on Thursday. And lastly, presentation clarity and effectiveness, and to see how much you know about the solution. So that's what we are going to evaluate in terms of when we are now trying to find out the winners of the hackathon. And then in terms of timelines, the application period has opened. We opened it last week on Tuesday, on the 8th of October, and it will close this Sunday on October 20th. So we encourage you, if you haven't formed team yet, you've got until Saturday to form a team, which includes at least one female member between the ages of 18 and 30 years, and making sure that at least one member of the team has a tertiary qualification. So we encourage you to form your teams as soon as possible so that you can be registered before the registration closes on Sunday, 20th October. And then the main hackathon days, as I stated earlier, it's 24th and 25th of October, in which we want you to be available on site at RSTP Innovation Park at Nogwane. And then in terms of the prize presentation, we will announce the specific dates on the 25th of October, when the people that have been participating on the main hackathon are now leaving to go home. Thank you so much.
Thank you very much, Ms. Mkhwanazi. I think one clarity is that I would, before I allow the participants to come in with their questions. The issue of the venue, you said Nogwane or Kotwani?
Thank you, Mr. Malaza, for the question. It's Innovation Park at Kokwini.
Another question would be, yes, we hear that the closing date is this coming Sunday, the 20th. What time is the closing period? Is it any time on Sunday or 12 midnight Sunday? What time exactly?
It's 12 midnight on Sunday.
Thank you very much. I think there's one question or the couple of questions on the chat box. What if you have registered and you want to change a few of the members and add members who have the tertiary qualification? If you already have registered, but you feel like after these presentations or these presentations today, you don't actually meet the requirements, and now you want to add a member or members with tertiary qualification, would you want to respond to that, Ms. Mkonazi? Is it still possible to change members at this point if you have already registered and it's still before the closing date?
Hello.
Thank you, Mr.
Sunny,
Malaza.
can I give a preamble before you answer that?
Yes,
Go
you
ahead,
can go
Doc.
ahead, Dr. Arnold.
Yes. So I think Sunny at some point was hinting that it's an advantage to have a tertiary education. I think that's the emphasis. It's an advantage. But I think we are not going to, because the target population or the target group is already a disadvantaged group. We are targeting the youth that may not necessarily have completed some of these qualifications, maybe because they ran out of school fees midway, but they have the talent and they can showcase that talent. They have got the the tenacity to complete a competition of this magnitude. So I would want us to frame it in such a way that we are not pruning talent based on certification. Although I still agree with Sane that it would be an advantage if one of your members does it, but we're not disqualifying anyone who actually has got the actual skills to provide a solution. I don't know, Sane, you can then elaborate beyond that.
Thank you so much, Dr. Arnold and Mr. Malaza. I wouldn't really encourage teams to. Okay, what I can say is that you can, because what the information that you have already put
has been answered in that answer. Please share all the FAQs so that we don't repeat the questions, frequently asked questions, I think. I think, can we get a number to call for more information? I'm not sure, Sane, if we do have a number that we can share, if there's anyone that wants to ask anything. And then if you've received the email that your team has been registered, are you secure? Please respond to those, Ms. Mkwanazi.
Thank you so much. If you've received the email that you have been registered, it means that you are secure. I'd like to answer another question, which asks that is each, like in terms of how many team members are supposed to register. I think this particular person is yet to see, but I can assist with regards to the form. When you are registering, it will ask only one member of the team will register, which is the lead team member, and then that team member will be requested through the form to provide the details of the other team members. So only one team member registers and the other details of the other team members will be provided by that lead applicant. Thank you.
Maybe another question before we take any. I can see there are no new questions on the chat box. Another question, Ms. Mkhwanazi, would be as a follow-up to the previous one. When does one get to see that they've been shortlisted? Maybe if you can give us that timeline and how we're going to be contacted for those that have been shortlisted. Thank you.
Thank you so much, Mr. Malal. Teams will be notified next week, Monday, 21st of October. They will be called, and also emails will be sent to them to notify notify them about the status of their applications.
Thank you very much. I'm not sure if there's anyone that wants to have any question. Can I be assisted? There's someone who's saying, please read questions on Facebook. Colleagues, can you please, if any of the colleagues from RSTP are here with me, can you please assist me, because I can only move from one. I can only check this one chat. I'll probably be able to access the Facebook questions soon. But if there's anyone that would want to, okay, someone is saying he still hasn't received the email. I think that one is from those that have applied. We will be responding to them soon. Will there be a top 3 or just one team will win? And how will we be called yet from the phone? The phone didn't require our phone number. I wanted to ask, what are the deliverables for the hackathon? Maybe let's start with this one, Ms. Mkhwanazi. What are the deliverables for the hackathon? I think the presentation tried to address that. And then will there be a top 3, or will it be just one team that will win? And did the form require for phone numbers? How will they be called?
Okay, thank you so much, Mr. Malaza. In terms of the one who said they didn't receive the email, I'm not really sure if he means the email of the pre-selection or the email for the form. If it's the email for the form, can he please notify me at the chat so we can see how we can assist him? That's the first thing. The second one, in terms of what the deliverables of the hackathon, so you will be given the problem to solve on the day of the hackathon on the Thursday morning. Then you are supposed to come up with a solution, of which we would require the top prototype as stated earlier on during the presentation, which you will now present to the judges. Thank you. In terms of winning, if it's yes, we are going to, 3 teams are going to win, but only one team, the first one, will get the opportunity to work with Georgetown. And then lastly, in terms of on calling them, my apologies. I didn't say that. It didn't going to email them, and then from there we will going to get the further information. Thank you so much.
Sunny? Can I chime in a little bit?
Yes, please come in, Doc.
So again, for all the IT professionals that are sort of like have been excited about joining this hackathon, I remember in my first presentation, it's not, the important thing is not an activity. I think as Georgetown University, as an academic institution, you know, we are driven by service, education, and research as our 3 main pillars. And the idea really is that although our resources are not a bottomless pit, we are hoping that we'll be able to engage at different levels with all the participants, or at least the top 3 participants in the, can you hear me?
Yes, we can hear you,
Senzo?
Doc, but even though you seem to
I hear some people
be
complaining.
breaking down a bit, but please, I hope your connectivity is stable now. You are breaking up a bit. But I think you can continue.
Yes, like I was saying, I think hoping that the reason why the RSTP in partnership with Georgetown is going to select the top 3 is we are hoping to find some form of engagement with all 3 teams, although at a different level in terms of the grading in that engagement. I may not be able to furnish you with the details of the pricing structure right now as we are discussing it, but of course the ones that will lead that will lead the actual evolution of the prototype into an actual solution is only going to be the top 1. But everyone who participates in that hackathon is going to get an opportunity to have something added onto their career in one way or another. There are going to be relationships established. Like I said, the RSTP is already, a hub for innovation, and I think a lot of you are going to be identified as future innovators and bright minds, and I think there are opportunities that will come up from participating just in this activity moving forward. So don't really focus on winning. Focus on the opportunity to showcase your talent. And I think there will be an opportunity for that talent to be realized, be recognized. Thank you.
Thank you very much, Doc, and thank you, Sanel. I hope that dear participants, your questions are answered. I think there's one that, Doc, if you can assist with, are we coming up with prototypes, or it's an idea? You come up with an idea or the prototype. I think in your presentation, the reason I'm throwing it at you, Doc, you didn't mention that we'll then later develop the prototype with Georgetown University, but please, if you can respond. And then do we stay the full 2 days at the venue for the hackathon? I think I'll respond to that one, yes. Until the last minute of the hackathon, you are not leaving the venue. Do we come up with a prototype, or we have to implement our ideas? I think the question is similar to the first one, Doc. And then which programming languages are recommended for participants? And then what resources are provided by the organizers in terms of equipment? Yeah, those are the questions. I think, Doc, please, if you may, and then Sanel Siwe, if there's anything that you'd want to add.
Okay. Sane, you back me up here with the sort of like value chain for developing a solution. But we are not looking for an idea only here. We are looking for a minimum value that can then be incubated into a business, if you want to call it that way. So we are actually looking for some form of applicable prototype that can be worked on when you engage with Georgetown. I don't know if that's clear, but Sunny, probably in your technical understanding of the value chain for developing a solution, what does that mean? I think to answer specifically to the professionals. But for me, it's a minimum viable that you are selling to a potential investor, if you want to call it that way. That can then be incubated or further developed to address the problem at hand.
Sanel Siwe?
Thank you, Doc. I fully agree with you. We are not just looking for ideas. We need a prototype, and we also we want to see when you present your solution, we want to see minimal functionality of your prototype. So we're not looking for only ideas. Hence, you need to come on Thursday, 4 a.m. Sorry, I meant 8 a.m. until on Thursday, 8 a.m. until Friday at 5 p.m. So when we are looking at the prototype, when we are evaluating, we are also going to look at for minimal functionality. So it's not just ideas. Sifuna kubona nale idea yakho uthi mawuyipresenta sibone nale functionality kancane. That will, because we are looking for solutions that will not just end here in hackathon. We are looking to then take it a step further and put it under business incubation so that you can be able to continue to work on your solution. Thank you.
Any programming languages that are recommended, and what are the resources that are going to be provided by ourselves to the competitors or those that will join the hackathon?
In terms of what we will provide to the hackathon, as I've stated earlier during my presentation, we are going to provide high-speed internet. We are also going to provide meals and rooms where participants are going to freshen up. In terms of now working tools like laptops, unfortunately not at the moment. Thank you.
Thank you very much, Ms. Mkhwanazi. Let's look at the participants. Any more comments, ladies and gentlemen?
I've just remembered something
Do we come with your own machines? Yes, you do come with your own machines, as previously mentioned by Ms. Mkhwanazi. You wanted to add something, Ms. Mkhwanazi?
Not at the moment, Mr. Malaz.
Okay. Okay, Bangamloi. People who have already started working on the projects. How are we going to make sure? I think the question here with that was on, do we come with our own machines or they'll be provided? If we come with our own machines, how do we make sure that there are no people who have already started working on the project? So how are we going to make sure that everyone is starting at the same time, Ms. Mkhwanazi?
Thank you so much. I remember just one in which I didn't answer earlier on in terms of MR programming languages. Please kindly look at them in the form, the programming languages that you're supposed to use. It's those Lala Pagulel form. Hence, we are asking you, can you please kindly select at least one, it can be at least one or more of the programming languages, it's in the form. And then the second one, can you please kindly remind me, Mr. Malaz? Or in terms of ensuring that no people start before, no one knows what the problem that you are going to try to solve is right now. So people are going to know it on the day of the hackathon. We hope that will ensure that no one starts before coding before the actual hackathon. Thank you.
Problem statement will be given at the same time for everyone. I'm not sure if we still have any questions, ladies and gentlemen. If we do, my chat box is empty. I can't see any hands. So I take it that we are fine.
Hello. Can I speak?
Okay, yes, please go ahead.
Oh yes, I might have joined a bit late, but I want to know like what is there any platform that will be provided for us to code when like on the day of the hackathon, like maybe some kind of platform, or maybe we'll be using our own machines or own environments. Did you get my question?
I think your question is, are you going to be using your own environment or it will be provided for during the hackathon, if I'm getting the question correctly?
Yeah, that's right.
Colleagues, can you please respond to that question?
I'll be listening. Thank you.
Thank you so much, Kolani, for your question. For now, let's say you are going to use your own environment, but this is another session that we hosted not just to disseminate information, but also try to understand clearly what will be required from us. But for now, we can say your own environment, but it's something that we can be able to look into and then update as we are registration. Thank you so much.
Oh, sorry. One last question. By the way, how do we register?
Okay, I think, Thanasiwe, before you respond to the question of registering, I think there's a couple of participants who have probably similar questions to the one asked by Kolani. I think Kawe Matimela wants to know how many members. It's I think 2 to 3. And then does the prototype have to be fully functional? Is it website or mobile application? I think these questions, Sanesi, are pretty much similar, if you may, and Dr. Arnold, if you may respond to those questions, please.
The membership of the teams?
Yes, Doc. I think there's a question on how many members should each team have, and then the other one. If you may remind me, Kolani, what was your question again?
Oh, I wanted to know the procedure for doing the registration.
For registration.
Yeah.
Okay.
Yeah.
Yeah. Those are the questions, Doc.
So I think on the website the number is 2 to 3, and Sanlisi will present 2 to 3 on in today's webinar. So I know there might be some other information circulating, but let's use the one that is being communicated by the RSTP.
I fully concur with Doc in terms of the number of teams. It's between 2 and 3, at least 2, but a maximum of 3 members of a team. In terms of how you register, I've posted via the chat box. I've posted the registration link. Please follow that in order to register. And then in terms of whether it's a mobile app or a web, I think I will give that one to Dr. Arnold. Thank you.
Dr. Arnold, as you to respond to that, is it a web-based or mobile application? Can you please also respond to a question on, is the use of AI allowed during the hackathon?
I think the details, because I'm now thinking already if people are going to start preparing. I think most of the details will be available at the hackathon when you actually get the problems being shared with you, whether you're going to be working an app-based solution. So for now, I think it's about familiarizing with the problems that I've mentioned and trying to think around what could be the things that we are going to be solving and how you would anticipate translating those solutions into digital solutions. So I'm not going to preempt whether it's a web or an app-based solution. Get that on the day. In terms of AI, I'm going to apply plausible deniability because whether we say you can't use AI or you can, I think AI is here to stay. It is a tool. It is not a replacement of human intelligence. So I'll leave it at that. And I think the organizers will be able to guide on how to move forward. Thank you.
Thank you very much, colleagues. Ladies and gentlemen, I think most of the do's and don'ts and the formalities around what we can do, what we cannot do, will be shared during the briefing session when the hackathon starts, because some of the information that we probably have questions on form part of the briefing session when we're about to start the hackathon. But for today, I am not sure if we are leaving any question out, but it looks like we have addressed pretty much everything that we have on the chat box. And thank you again for joining us today. Dr. Arnold, am I leaving anything out? On your side, is there anything that you want to add before we end today's meeting?
No, I think, thank you very much. I think just to appreciate the level of interest, I think the questions in terms of their inquisition show the level of interest in this activity. And we hope that at the end of it all, collectively as an IT community, we're able to impact and contribute to the HIV response. So thank you very much for your participation today.
Sanel Siwe, anything that you'd want to add before we end our meeting today?
What I'd like to say that on the chat box, I've provided contact details for more information, which is an email code for care@rstp.org.sz, and you can also call 7627-9571. Thank you.
Thank you very much, ladies and gentlemen. Thank you, colleagues, for sharing information. For those that missed the last part from Ms. Sanel Siwe Mkonazi, for more information, you can send an email to code4care@rstp.org.sz. Code for care, that is one word, at rstp.org.sz. And you can call 7627-9571. Please, ladies and gentlemen, can we use that number during working hours? And then can we also just use it for purposes of getting information on the hackathon? Nothing more, nothing less, ladies and gentlemen. And then soon after the deadline or the registration deadline, that number will no longer be in use for purposes of the hackathon. I think after that, we will continue with the email for anything that we would want to know. From myself, it's been a pleasure, ladies and gentlemen, hosting you, and thank you very much for being such a great team. I do hope and encourage everyone, particularly the youth, to participate, to register for participation at the hackathon. We want to make sure that we all join hands as the nation towards ensuring that we assist the country, we assist the youth in particular to access health services without fear of discrimination. But above all, we want to join hands in making sure that we digitize the health sector, because like the rest of the world, we cannot be left behind. Most things or services are now in digitized. So let's do that, and let's all be proud of the contribution that we've made. And as my colleagues mentioned, we are not only looking at this as a competition or just a hackathon, but we're looking at this as a platform that will give us people that can now be incubated, that can scale this up into a business, and a successful one at that. We can develop these systems, ladies and gentlemen, for local use, but also let us be aware of the fact that we can then export them. Countries like Rwanda are doing that. They are developing systems for their own use, but upon seeing the success rate of those systems or platforms, they then export them. We can do the same. Thank you very much, and we wish you a very productive day ahead. Thank you, and God bless you.